Hi, I'm Ron Roel, the host of 45 Forward. Today, during Older Americans Month, I'm delighted to welcome back to the show one of my newer older friends, Kathleen Otte, who was my guest on the very first 45 Forward episodes, which I launched just over 5 years ago when the country was still in the midst of the COVID-19 pandemic. At the time, Kathleen was a regional administrator for the Administration for Community Living, or ACL, which is part of the U.S. Department of Health and Human Services. ACL oversees the implementation of the landmark Older Americans Act, promoting the independence, health, and well-being of older adults and people with disabilities, as well as their families and caregivers. Since she was a young woman, Kathleen has had a passion for working on behalf of older adults and family caregivers, spending almost 30 years in the field of aging. It's an authentic passion, a joyful passion. She's realistic about big challenges, but always forward-thinking, steadfast in her commitment to a better life for elders. Kathleen retired last year as a regional administrator for the Centers for Medicare and Medicaid Services. It was time to relinquish her government responsibilities and, of course, spend more time with her 11 grandchildren. And today, it's a perfect time for me to sit down with her and reflect on her career, share her wisdom and insights, and to think about how we can better care for our seniors, our families, and ourselves. So now, let's welcome Kathleen Otte to the show. Kathleen, welcome back.
Thank you, Ron. I have to tell you, I was honored to be your first guest, just as I'm honored to be with you today. Thank you so much for having me back now that I'm retired. So I appreciate it very much.
Well, it's an honor for both of us, and it's just a real pleasure to, to just think back and say, yeah, we're still here.
We're still here, and reflecting back on the many years that you and I've had with aging, I think we loved aging when aging wasn't cool. So it's one of those things that it's good to be
That's
with you today to see how far we've come and discuss maybe some things for the future as well.
yeah, yeah. The first thing we'll have to do our T-shirts. Aging is cool, right?
Yeah, right. That's
Oh,
right.
wow. So listen, let's just talk a little bit about, so you've retired and you had a great career. And I know there's a lot of talk now about the government cuts and Doge and all that stuff. And so I just wanted to not dwell on the politics, but just talk a little bit about, from your perspective, about, what has been the impact of the cuts, just from the perspective of not what just what we lost, but what remains and how we can think going forward.
No, that's a good question, and actually a good place to start, because I think many times what we fail to do is to see how we got there. And
Mm-hmm.
in my career, I really followed my passion. I always have loved aging services from the time that I was in college back in the 70s, when aging certainly wasn't cool and you couldn't take any classes in aging. But why I say that is because we truly have come a long way in really a short period of time.
Mm-hmm.
And, the situation that we find ourselves in now, I'm pleased to say we've made a lot of progress. Science has helped us with that, certainly knowledge and awareness, and even people growing older really recognize the value of exercising and nutrition and so forth. So
Right.
we really have come a long way, even though it has been a relatively short period of time. But there have been some changes, and I think again one of the challenges has been is this new normal that we find ourselves in,
Mm-hmm.
where many of our colleagues, I was based in the New York office, as you know, and we represented New York, New Jersey, Puerto Rico, and Virgin Islands. But I worked so closely with my colleagues across the nation on issues such as caregiving. And we really made some
Mm-hmm.
progress. Now it's a little different. Now we
Mm-hmm.
have federal hubs. The regional offices don't exist any longer. They were eliminated last year. And, we lost a lot of that partnership building capabilities whenever that occurred. Doge certainly came in looking at how IT could help us and AI could help us deliver our services. So it's a new environment today as it relates to when I left, because we were so prideful about the relationships we built with our states, the communities that are within those states, and the people who came to us and shared their stories with us and helped us understand how we can make policy better and more appropriate for their needs.
Yeah, so I know that, I have no issues with trying to work for more efficiencies. I mean, the the mantra is, eliminating waste, fraud, and abuse, the
Yes.
big trio. But determining what that is exactly and understanding the when you eliminate the regional offices,
Yes.
as I've learned in my caregiving experiences, that caregiving and delivery of services for older folks is like real estate. Ultimately, local, local, local.
That's right.
And so, that's one thing that you've talked to me about, which I think is important, is that it's not just having the federal services, it's how you deliver them and share the information, responsibilities, and the troubleshooting on a local basis.
That's right. And we see that, you're exactly right. We see that highlighted when we have disasters. And
Mm-hmm.
again, just reflecting about my experience in New York. And by the way, I'm a Kansas, Oklahoma girl. Never really imagined I'd live in New York City. But one of the things, and what my daughter said, is that we were kind of living the dream that we didn't know we had to move to New York, because there was a lot of innovation there and in Massachusetts as well. But I go into that to say during Hurricane Sandy, and also, anytime we had any disaster, fire, etc., or COVID, we saw how those partnerships are so needed.
Mm-hmm.
The federal working with the state, getting information, getting ideas, reporting back to Washington D.C. So they truly had an eyes on the ground experience. I think we've lost that, and that's my opinion. I haven't been working for the last 12 months, but I just remember those partnerships as so strong, and I don't know how they could be in the current situation. So it remains to be seen.
Mm-hmm. Yeah, yeah. So what does remain? I think you mentioned to me some of the essential things. I mean, like nutritional support, right?
Yes. So very important. And again, one of the things that we've learned over the course of the many years is that it really takes an all hands approach to different things to grow older. Certainly, we know that mental health is very important, and making sure we minimize stress. Nutrition is one of those. And ACL, the Administration for Community Living, continues to do that.
Okay.
They work with states to make sure and ensure that people who have needs, basic needs like, I need some food to eat, especially in these challenging times when gas is $4 and $5, that the services are there. And I'm just entirely appreciative of my colleagues at ACL, because they continue to do the hard work and the challenging work with the budget and so forth as we go forward.
Yeah, yeah. Um, I just want to take a step back and just wax philosophical for a moment.
Sure.
And that is, one of the things that I think is, well, I guess it's provocative. We're in an era where we're sort of challenging the role of government, as we always should, since the
Absolutely.
beginning of the nation. But there does seem to be a little bit of, I don't know, disregard. I mean, and let me just, one of the things, yes, he was a liberal Democrat, but one of the quotes I find compelling for me as sort of a touchstone is Hubert Humphrey's quote: "The moral test of government is how a government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped."
That's right.
And especially in an era where certainly we're an aging population, we're going to be older and older, and living hopefully better in those years, as you mentioned. So that's good. And then we have also, a more inclusive society with a recognition that if you just make some accommodations, that those people with disabilities can make a substantial contribution all the way through. So I just feel though that we're focused a little too much on cost savings as opposed to what are the ultimate returns on investment of providing these services for seniors.
I so agree. And you made mention of that quote, which, of course, if you walk into the Humphrey Building in Washington, D.C., that particular quote is etched in stone. And I reflect, and really, I will tell you, I was always humbled when I walked into the Humphrey Building, because that building was dedicated in the 70s. And I mentioned in my career, Aging was not thought of as a real need or a service at that time.
Mm-hmm.
I mean, we had senior centers that came about as a result of some of the funding in 1965. But in the 70s, we were still just kind of starting that path. So I think, again, it brings us back to the root cause of why federal government is needed, and that is to provide consistency throughout the states, to give services to people who are in need, and to support those people who may have a disability or financial challenges as it relates to purchasing food, and even health care. My work at CMS, and Medicare and Medicaid taught me that as well. That all of these services that the federal government provides really go directly to people who are in need and who are living longer because of it. And I think you're right, the return on the investment is a quality of life that Americans enjoy today because of people like Hubert Humphrey and his vision for what health and human services would be.
Yeah, and I don't, diminish the importance of the private sector or nonprofit sector. Certainly, I do think that the official government, along with the communities and the nonprofits, should partner to deliver these services. And as opposed to saying, well, what, this isn't the role of government. Leave that to the churches and to
Yeah.
then families.
Yeah.
Things have changed over the decades.
They truly have. You're so right, Ron, because people used to make that assumption, why do we need these services? Because the neighbors or the family members will take care of somebody who's living alone and maybe is disabled and can't, is not mobile. My grandmother, and I think that's probably one of the reasons why I went into aging services. I remember going with my grandmother. I was 6 years of age, and she would make a breakfast and a lunch for two of her neighbors every day. Now, that was before home delivered meals. That was in the early 60s.
Mm-hmm.
And I think that I saw that need firsthand, those memories still stay with me. But unfortunately, older people many times can't do that any longer, or family members who used to provide care are no longer able to do so because they're working, or they're taking care of grandchildren, which we've talked about in the past, or they have limitations where they just don't feel they can do that. And so, we need federal government and state government and the private sector to work together so that we can really work on behalf and be an advocate for older adults. And when that happens, it's beautiful.
Right, right. Now, one of the challenges has been always that there are resources, but people don't know how to get them. And I've talked to some people locally with the area offices on aging,
Yes.
and they tell me that sometimes they get a call from someone saying, "How come you don't have this?" And they're like, "We do have it. Have you gone to the website?" And oh no, I have. Oh, well, so this is a challenge about, as you know, for aging services, and in the area that I'm particularly interested in, caregiving. This constant, unfortunately, sort of crisis mode that people don't. They don't look for services until they absolutely need them, and probably beyond where they need them. So, so how did you address some of these? I mean, it seems to be a constant challenge.
It is a constant challenge, and I think what adds to that is that emotional factor, that human
Mm-hmm.
factor of feeling so overwhelmed you don't know what to do. You're almost paralyzed because now you're providing caregiving where maybe you didn't anticipate doing that, or maybe it's gone longer than you anticipated, and you just don't know where to go. So everything seems to be overwhelming. How we were trying to tackle it when I left CMS, we were working very hard on caregiving services. We had
Mm-hmm.
partnered with ACL, which is the Administration for Community Living, working with them on their programs that are already in place. And then also SAMHSA, which was the Substance Abuse and Mental Health
Mm-hmm.
Administration. It's no longer, it's more or less defunct after the reorganization of last year.
Mm-hmm.
And that's a sad thing because mental health plays a large role in the work that we do for caregivers, especially because they feel depleted, they feel tired, and they need emotional support as well. But I go into that to say we were looking at maybe we had an initiative where we queried states about what are, hearing from caregivers, what
Mm-hmm.
do you think we need? And then we also listened to state directors. What do you think we need to do? What do you?
Mm-hmm.
And it was saying, people were saying that. what would be very helpful would be have one central repository where everything is there.
Mm,
And so we said, well, gosh, yeah, that doesn't diminish the local opportunities for people to learn. But what it does do, it gives a repository for people to go to one place. And I say that because we were trying to see if the federal government would have one caregiving uh, web page where people could go. So it wouldn't just be ACL or CMS, it would be maybe Health and Human Services, and
wow.
everyone could go there. And I retired before I could finish that idea, but I do think it's a good one, and hopefully in the future they will follow up on that and see if they can institute it, because even though there's wonderful resources available for people, that being overwhelmed, not knowing where to go, would really be minimized, I think, if they had one place to search. And then they could look locally for other services.
Right, right. That's a great idea. That's something that I've been thinking about on a local basis, sort of the one-stop shopping, because I think it is, it's a matter of the caregivers and their families needing to find the resources, and it's a matter of the providers, whatever sector they're in, to know about these other services and know when to refer people, and know where to go themselves.
That's true.
So it's again, I think we need to catch up to the reality of that society structurally has changed, and as you intimated before, people are not in the same places.
Mm-hmm.
It was great when you lived with your grandmother, and that was, my my dad and mom lived with his parents after they got married, and then they actually moved out, from Brooklyn to
Yes.
Long Island, and of course the first thing that I recall my grandfather saying, "What do you have to move for?"
That's
But this is where we are as a society. We have aspirations, we have mobility, and so the traditional family functions are strained, and so we need to address that reality. And as you mentioned, Kathleen, one of the things that I think has unfortunately come about in part from COVID, right, is just the mental health capacity, the
mm,
health challenge. And I think we underestimated what this challenge is, and and
totally
that
agree.
that's and also that it's there when we're younger and older.
That's true. And depression being one of those things, as we grow older, we need to be cognizant of.
Mm-hmm.
Physicians are now we have their physical, if they have their annual physical at CMS, one of the questions that physicians are asking is, do you feel down? Are you feeling depressed? Because we're educating physicians to look for that as we grow older. But you're right, mental health, declining physical health also adds to that depression. And I think also as we age, and I'm 70 and we've talked about that before,
Mm-hmm.
you know that you're not going to live forever. You want to live the best life you can, but you begin to think about, well, what legacy am I leaving my kids, my grandkids? What lessons do I want to teach them? What experiences have I had that I want to share with them?
Right.
And I just think that it can be overwhelming for someone who doesn't have the resources to keep healthy and busy. And routines are one of those ways by which we can all do that as we get older, to establish a routine, follow it through every day, stay astute and socially engaged. But that doesn't negate the fact that we all have periods of depression or feelings of feeling down.
Mm-hmm.
And we don't know really what to do or where to go sometimes, just like we're talking about with caregivers. But without some help and support, whether it be a good friend or even an agency to help you, I think older people can really suffer, chronic diseases and things that add to this in a way that's different than someone who's in their 30s, 40s, and 50s.
Yeah. Now, speaking about this longevity, so I think one of the big challenges now is that we didn't think about was caregiving in our later years,
Yes,
right? So
that's right.
long-term care. Now we have as you've noted, more options today than we had when our parents were getting older in the 60s and 70s. So that was a time when people were just terrified of old age homes, right?
That's right. That's right.
But there are more options today. But what are some of your thoughts about how we can maintain the vitality of these institutions and provide options? And it is still tough, there are, we're all well aware of the issues with nursing homes that happened during COVID, where they are better than they used to be, but there's still structural issues. So,
That's right.
what are some of your thoughts about how we can provide long-term care as we continue?
Yeah, I think I've shared on a previous podcast. I'm a former nursing home administrator. And again, going back in time, really, that
Yeah.
was, if you were interested in aging services, nursing facilities were really the only place you really could go and, do a deep dive into aging services at that time. I loved my time as a nursing home administrator, and I hope and tried to make a difference, but I recognized the challenges that are there and continue to be. As I've been away from that field for about 20 years, I notice all of the attorneys on television that are encouraging people to sue, sue, sue. And while I understand that and think that's a legitimate option for many people, I would also tell you that causes the cost to go up to a nursing facility because they will pay more in insurance rate. And that takes away from the wages from people who are providing the care. And I think also it diminishes their desire to do a good job because they just feel helpless and hopeless. And I'm not blaming the attorneys, but I'm saying that's a difference that I noted from when I started out back in the 70s to now. It's a very litigious situation.
Right.
And so all of that combined, I don't know really what the answer would be. I think we've come a long way, and I always like to talk about some of the positive things that have occurred. One of which is that we have person-centered care, which we focus on individual rights in nursing facilities, and we include the families in a larger role to help us understand what their loved one needs, and also to use them as a support system for their help and care in the facility. So I think there's some positive things that have come about, but the regulations have been challenging for nursing facilities. They try to meet the regulations, and then if they don't, then they're penalized substantially. So it's a really difficult place to be as a nursing home administrator these days. And I don't think people take the time to really look at the good work that's going on there and the different hoops that the administrators have to go through to deliver good care. It's challenging.
Yeah, it is, and I think that's an area where we need innovation. We need to provide ways to do it, and I think that some of them, some of it is recognition of. I think you've told me before we have too much regulation and it's in the wrong places.
Yeah, yeah,
um,
yeah.
so one of the stories you've told me that I wanted you to talk about is in your early years, which I found really compelling, an indication of what are we really talking about when we say we want people to age and with safety and security, but also dignity. And that is, you told me the story about the couple who got married.
I did, yes. Which I have to tell you, Ron, I still think about that experience frequently because it was just so meaningful to me. But I have 20 years old, working as a nurse aide in a Kansas nursing facility, and two older people had fallen in love at the nursing facility, and against the will of their children, they went ahead and got married. So here I come in to work for a summer to, kind of begin my career. And this lovely couple who loved each other, but were both 95 years of age, they wanted intimacy. And so they tried to lock their door or put chairs against their door so that the nurse aides wouldn't come in and bother them. And they also tied their beds together so that they could sleep close to one another. And of course, we as diligent soldiers in the nursing facility were told that's against regulations. You've got to be able to have a door that's open so if there's a fire, we can wheel them out. And, we can't have their beds tied together for that very same purpose. And so I was one of those that had to go in there and untie the beds. And it bothered me then, and it still does now, that we didn't recognize that people need love and to be touched when they're older. And so we've come a long way because now we have flexibilities for people who, um, you know, um, dare I say, have sex in nursing facilities or
Yeah.
assisted living facilities because we're human beings. But we were more aware of some of the needs of older people as they are in institutional care.
Yeah.
So yeah, it stays with me. Another thing that I think I shared with you is I have 11 grandkids and I bathed a couple of them in my time. But there was a lady that was in her 40s in that same nursing facility that had multiple sclerosis. And I would give her a bath, and she would tell me, Kathleen, wash my face first. Because many people don't think to wash my face first. They start in on my
Hmm.
body. And so there's life lessons that I've learned as a result of those 3 months that were the hardest work I've ever done in a as a nursing facility worker. It was tough to be a nurse.
Yeah. Yeah. And I think that we, as I think again, partly from COVID, when there was a time when, because of infection control, people couldn't go into these facilities, unfortunately, as their loved ones just were
I
dying.
know.
So I think that I know that there's the Essential Caregivers Act that's being considered in Congress now, to really address these issues, as you put it, that just because someone goes into one of these homes does not mean the family is no longer caregiving. And
Absolutely right. And when we did our initiative at CMS in New York, and we spawned this national conversation about caregiving, we interviewed nursing facilities, primarily in the New York area, to say, tell us about how you work with family members. And they said they're an integral part of the work that we do, and we need to include them. The guilt factor more than anything is what a family member feels.
yeah,
We talked about, what it's, if you have a facility that you place your mom or your father, your grandparents in, there's guilt that comes along with that. I can't take care of them.
right.
So I think recognizing that the family members need to be a part of that caregiving team and helping with their care is really so important. And the facilities value that most times, unless they feel they're intrusive and prohibiting care, but then that's something the nursing home administrator has to deal with.
Yeah, I think like in most situations in life, it's two sides. So I think that you could say, well, the families are not involved, and then when they reach out to the families and they don't show up, then you're like, well, so I see. So you're just trying to, you're trying to dump your parents here. So
Yeah,
it's hard. So
that
you need to be
happens.
assertive on both sides.
And that happens, unfortunately. And that's where a caring nursing home staff comes in and really fills a void. And I've seen that any facility I've ever worked at where the staff comes to the rescue.
Yeah. So just to we're coming to the close soon, but I just wanted to reiterate a couple of things. So, as society continues to change, and I think one of the challenges is the speed of change, right? I mean, I think
Yes.
that we it's a little like whether climate change, what the result of it is, or the causes of it are. We are experiencing a lot of violent weather, and
Yes.
so I think we're similarly facing a lot of fast change, especially with AI. So,
Yes, we are.
yeah, any as you were leaving the agency, any thoughts on, well, how do we address that when things are happening so fast? What
Well,
are
there's a lot of good work going on,
okay,
and our conversation in previous times has really kind of made me think about some of the resources that I know are available.
okay,
So in Boston, we have the MIT Aging Institute that's led by Dr. Joseph Conklin.
mm-hmm,
He's doing a lot of work with AI and also, some of the science work that's going on at Harvard
mm-hmm,
to see how we age. So science is really on our side, I think, and
okay,
we've got great pioneers there. So I think that's one thing. We also have another Human Nutrition Research Center. This is a center that has a portion of the USDA involved with it, but it's out of Boston, and they do scientific research on. You remember the study on blueberries not long ago,
yeah,
where they said the blueberries are the best for. That came from the Human Nutrition Research Center, and I think that there's a lot of good educational and research centers that are looking at some of the things that we're talking about and how AI could help or science could help us understand these things. So that's kind of the new age thing.
mm-hmm,
But I think we're also looking at how the older adults, age 60, 70 years of age and older, are helping to contribute to the economy. I mentioned Dr. Conklin, who's there at the MIT lab. He's written a book on how much the older adults give to our economy, and how they give back. And so there's just a lot of things going on, I think, in our future that we're really not even aware of now. But I think science, I think AI to help with mental health and loneliness and even dementia. I think also caregiving to a certain extent. We've seen and heard about robots and so forth in our future. Maybe someone on a screen, but we've seen AI help people with dementia to feel less scared and so forth. So those are just a few of the things that I think are the exciting parts about growing older in this day and age, is that we've made leaps and bounds in science, and I think we'll continue to do that as we move onward.
Yeah, I think one other thing that I think has been very positive is in the medical field and the healthcare field. We've been using technology to facilitate what we call sort of person-centered or patient-centered
Yes.
care, which is the ability to get more information about who you are and how, what your health is, to help you take control of your personal health. And I think,
That's absolutely right.
I think that's something that's important. Certainly, as we live longer and longer, and our resources can't quite keep up. Think, well, how do you sort of preventative health? I think has become a big important component of how we cope going forward.
I totally agree. And just to add on to what you say, something I think that you and I've talked about again is that we need to be models for our children and our
Mm-hmm.
grandchildren. We need to be able to share examples of how or things we would have done better. I eat so much candy, so much candy. I had candy bars I don't eat well. And that's something I've passed on because I've had to take supplements, nutritional supplements to help me because I'm such a poor eater. And I say that because we can be teachers and models to those that come after us if indeed we take the time. That even goes to say, saving for retirement, beginning when you're younger to have conversations with when you're older, having conversations with your loved ones, your grandchildren, your children about, how they could be a wonderful aging adult through the lifespan.
Right. So now you're going to retire and do what a lot of people say, which is spend more time with grandchildren. What are you going to do?
So I am the reverse of what most people do. A lot of people downsize. We've just purchased a big home with a pool so we can have all of our family members over. My husband and I lived far away from our families for so many years that we want to bring everybody back together. So we're hosting every birthday party. We're, hope to have big pool parties. And, I think what we come back to is what all of us really strive to when we get older is that sense of family.
Mm-hmm.
Bring people. We have a blended family. And I'm thankful to say it's the best blended family I'm aware of. We just really all love one another. And I think the development of the family helps me as an older adult age because I know I have the strength of my children to help me grow older.
Mm-hmm.
And then I have the happiness to watch all 11 grandchildren do their own thing. And that's been fun too. So, I'm excited for the years ahead. I think they're going to be fun.
Yeah.
Probably tiring, but fun as well.
Right. But I know that know who you are. You've always been active, and you've mentioned that you still would like to continue in contributing to aging issues. How so?
Well, that's a great question because one of my good friends said, Kathleen, do absolutely nothing for 12 months.
Okay.
Retire, come into, those routines, settle into those routines, and then make a decision. I'm passionate about elder abuse,
Mm-hmm.
both financial and caregiver stress. We've talked in previous times
Right.
that can all happen. So I'm interested in maybe exploring opportunities to really volunteer or really join some national organizations to have some conversations about that. Again, stress causes some abuse, neglect, and exploitation. And, anything we could do to prevent that or make people aware that it's happening, I think would be helpful. So that's one of the things that is my passion.
Mm-hmm.
But I also, I want to be able to be a mentor for my grandchildren to
Mm-hmm.
see what volunteerism is like, giving back, being thankful and
Mm-hmm.
grateful. And so I hope to do some of that in the next year. So if we talk in 12 months, maybe I'll have more stories to share. But
Great.
that's my goal at this juncture. But retirement's been wonderful. And where I thought I would have a problem with it, I've really loved it.
Well, I look forward to hearing those stories. I know that, we talk these days about, for lots of reasons, there are more grandparents taking care of grandchildren, but for different reasons, and not the way you're talking about it. But I think that, you do, when you talk to young people, you do hear stories about how important their grandparents were as models. So
That's
I'm
right.
glad that you're going to be a model for 11 of them. And,
I'm
and
trying.
you will, and I look forward to hearing their stories about
Oh,
their.
yes. They
But
would probably have some good ones.
yes, yes. So, well, thank you, Kathleen, for again a terrific conversation. I always look forward to talking with you, and I look
And
forward
you
to
as
again.
well, Ron. I appreciate the work that you do and also the topics that you choose. I think they're so important for all of us to be aware of and engage with. So thank you.
Right. And if people want to get in touch with you just to find out more about you, is
Oh, sure. I can give you my email,
sure.
k9audie@gmail.com. So K9Audie, I love dogs, at gmail.com.
Okay, very good. Okay, Kathleen, thank you so much, and I look
Uh,
forward to our next encounter. Thank you.
Thank you, Ron.